Welcome to Ask Sid, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back to Ask Sid. I'm your host, Aanchal Bhatia, and today's conversation is very important if you have an Ozempic face or you know someone who has an Ozempic face. We have the famous Beverly Hills surgeon, Dr. Elie Ramly, Harvard-trained plastic surgery guru, or like God, whatever you want to call it, here at Beverly Hills. Thank you so much for coming, Dr. Ramly.
Well, thank you so much. It's great to be here with you. And I'm very excited to be talking about this topic. This is a topic that's not just kind of a hot topic in facial rejuvenation, but, we do see a lot of patients who are suffering from changes in their face after massive weight loss. And whether that weight loss has happened because of diet and exercise, bariatric surgery, or now more commonly GLP-1 medications like Ozempic or Wegovy, Mounjaro, Zepbound, all these medications. What happens is when the weight loss is lost rapidly, there are significant changes in the face. And what I specialize in treating is restoring the patient's face to their own identity. So what happens is there's a mismatch when patients come in between how they look and how they feel inside. And so that change, whether that happens because of aging or weight changes or a combination of both, which is the more common scenario, is what we're solving.
And this is unique, right? Because back in the day, a facelift equaled vanity and not necessarily a need. And the whole narrative or the judgment or the societal view around doing stuff to your face is changing, right?
That's such a great point you bring up. I think, I hear that word a lot. Even some patients come in and they say, oh, I feel vain even considering this and so on. But I think that's very, unfortunately, that's something that culturally has become a concept, but it is a very artificial. I feel like at the end of the day, how you feel and how comfortable you are in your body and how healthy your body is are so intertwined.
Absolutely.
The mind body health is we're one. We tend to think of it as separate, but at the end of the day, if you're feeling uncomfortable with how you look, and obviously there's degrees.
People are on a spectrum, right?
On the spectrum.
Yes.
But there are things, and luckily we live in a time where these things, whether non-surgical, surgical, are feasible. There's a lot of things we can do to realign that and for people to feel their best and regain their confidence and feel like they're at home in their body and face again.
It's nice that we're in these interesting times where it is more acceptable
Yes.
for a wider number of people, right? It was only for select professions or type of people. But now, like you're saying, it's okay to go in for plastic surgery. It's okay to change your facial features to feel good inside your body.
Definitely. And definitely the overall sentiment around that has changed. And I think that's good. Self-care includes being able to make modification. And that's a very personal decision. It's not for everybody. Aging gracefully is a very personal concept. It means different things to different people. And surgery is not the answer to everything, but it is a great solution for some of the things that people want to change. There's also a wide range of non-surgical treatments, and there's a lot of things that just have to do with staying healthy and wellness and preventing problems before they happen.
Yes.
And it's very, very natural to want to improve ourselves, and it's great to know that there are options for that.
Well, that's exactly what I want to unpack today, because there are few people who are not even aware of the various options they have. Like, they feel going to a plastic surgeon means they have to go under a knife, or they have to get a facelift. And there's so many different types of facelifts. And so I really would love it if you could just, for some people who are on the fence, who don't know what their options are, and they're not happy with the way they look, and it could be because they've had access to, Monjaro and semaglutide now, so they're more in control of the way their body looks, but something in their face or neck may not be feeling that great. So can you help us, just give us like what are our options? And of course, you have double credibility because you're from Harvard, and tell us like why Harvard is the best, and like what did you learn at Harvard, and what are you bringing to Beverly Hills? Because Beverly Hills is also like the leader as far as like where all these, people are more adventurous here. People are the first to try. And so tell us everything that we need to know.
For sure. Okay, so I am fully trained in both general surgery and in plastic or reconstructive surgery. And I think that that is a very special combination because in general surgery, you deal with all the entire body, but also the entire, digestive system. And you deal with weight loss surgery, and you deal with what metabolically what happens with the body, whether in health or in illness or in weight changes. And on top of that, in plastic reconstructive surgery, you also deal with changes throughout the entire body and all the techniques that go into that. In addition to that, I did training and spent years working on facial transplantation. And
Mm.
so that was one of the things between that and between going on missions for cleft lip and palate.
Let's stop at the facial
Yes,
transplantation.
yes,
Is it
yes.
like, okay, we've all watched Face Off, and like,
Yeah,
we all
yeah.
expect like it to be very dramatic, but just what is facial transplant and how dramatic is it, and why do people go for it?
So on the range of facial surgery, this is the most dramatic, the most advanced, the most extreme of facial surgeries. This is when there's a very bad injury. It could be a burn or a ballistic injury, a car accident, a gunshot, anything that's really modified the face to a point where conventional reconstructive methods are not going to achieve any return to normal. This is when facial transplantation is an option, and that's essentially somebody uh, who dies and is an organ donor and is willing to donate, just like a kidney or liver, willing to donate a face. And those are very, very select patients where the person who really needs a face is able to receive that gift. And it's a very advanced surgery where the full face can be restored, including bone, muscle, skin, nerves, blood vessels. And so that's
Do they look like the cadaver or the donor, or
a great question. We've studied that extensively, and it's actually in between, because a lot of the components that make the structure of the face, like the bones, are still the recipient's components, and some of the components come from the donor. And so it's really a mix. We also studied how patients feel about that change and whether they view their new appearance as self, and how they integrate that over time as they heal, not only from the having healed from the trauma, but then healing from that surgery.
so
So
you
that's an
don't know
extreme.
what the outcome will be when you're reconstructing?
You have an idea. There's a lot of virtual planning that goes into it.
AI,
And
I'm sure, can
at the
step in today.
now, as AI evolves, yes, but there's a lot of virtual surgical planning that involves CT scan three-dimensionally of the donor and the recipient and so on. So that's an extreme of
But there's no
surgery.
elective face transplant
No, it's
option.
selective in the sense that you schedule it and plan. I mean, you have to do it when the donation becomes available, but at the same time, the patient is prepared for it, the recipient. But you're right. That is an extreme scenario where like nothing else is an
You can
option.
say that I don't
That's
like
the
the face that I'm gonna get, and like go for the next one, or
it's definitely there are that's a great question. There's some parameters, so it still has to fit certain parameters. There's also the big component that we have to bring up is the immune suppression. So when you get an organ donation, you have to your body has to be on medications that prevent rejection of that organ, and so they have to be on medications for life. And so facial transplantation is still in a state where now we've demonstrated that it's feasible, but it's still in a stage where that's reserved for very severe extreme injury. So that's the
so we should come back to the
yes.
Ozempic face,
So that is
and
the
for us,
end of the spectrum.
okay.
before all of those things,
Yeah.
there's okay, well, when there's not necessarily a trauma or God forbid, a cancer or anything that's really distorted the face, and we're not in a reconstructive scenario. If we are in a elective cosmetic scenario, so that can include aging, that can include weight loss, and so on. What are our options? We all know about facelifts. There's different types of facelifts. You brought that up.
Yes.
Let's break this down. So facelifts have evolved a lot over the years, and there's words that you'll hear deep plane facelift,
Mhm.
you'll hear a smash facelift, you'll hear a mini facelift, and there's important distinctions. And you also hear that traditional facelifts used to just pull the skin and give you distorted results, and now with the modern techniques we're working on the deeper layers and we're able to give a much more natural result. And that is true, but there's a lot of nuance in there that is lost in the social media conversation. So it's true that you want a facelift that works on the deeper layers. That's absolutely true. If you're just pulling on the skin, you're going to get unnatural results. You're going to get distortions. You're going to get pulling that you probably in older facelift, you'll see kind of the earlobe is
Yeah.
pulled and the scars widened and so on. And those are obviously types of facelifts that should no longer be done in any way. Now, what do you do to a deeper layer? So a deep plane facelift is a wonderful option. Now, the deep plane facelift is nothing new. It's been present since the early 90s, but it's evolved a lot and there's a lot of refinements to it. So the modern deep plane facelift is a great operation. There's also SMAS techniques that offer wonderful results as well. And so the key, and within those SMAS techniques, the SMAS is just the layer of fascia that encases the muscles of the face, the mimetic muscles that move the face. And so in a deep plane, you're dissecting underneath that layer and lifting it. Important thing here is that's where the nerves live.
Ouch.
So that's you have to be very careful about that. And in a SMAS technique, you're still working on that SMAS layer, but there's different things you can do to it. So the deep plane is lifting that layer. The SMAS plication is tightening up that layer with sutures. The SMASectomy is resecting a portion of that layer and putting it back together, and that creates a lift effect too. So the modern facelift should absolutely always address the deep layer, but what you do to that deep layer, I think, is the distinction. And what is absolutely missing from today's conversation, in my opinion, is people are just applying one technique to everybody. And that's so wrong because every face is so different. I mean,
Absolutely.
we know that intuitively. And on top of that, we know that anatomically, we
Yeah.
know, and every face is different throughout the process of aging and whether there's been weight loss or not. So, where else in medicine do we just like take one medication, one dose, apply
But
to everybody?
certainly not at
Right.
Sydenham. For us, it's all about precision medicine. But you
Absolutely.
are right. A lot of surgeons have gotten very good at one technique. So should we be choosing our surgeon based on the type of face we have? Or like, how should we go about that decision making?
Such a great question. I think, I always tell my patients there's no amount of research that you can do that's going to be a bad thing. So I think, first of all, you should see different surgeons. You should, part of your journey should be to evaluate different surgeons. And a very important thing is, first of all, you have to look at their results. So the results have to be results that
How do you even know if those photographs are real or not? Like they show you before and afters, but with makeup, with lighting, with, I mean, Kris Jenner's facelift is like all over. Like everybody's talking about it, right? But none of us really know behind the makeup, behind the lights, like what is the real result?
well, we do know to a large extent. And then there's here's the thing. So ideally, when you look at before and after photos, standardized lighting, standardized background is very important. We try to have photos that don't have any makeup on before and after. Now, it's very interesting when patients come in for a follow up appointment. It's so funny. These little things are such big indicators of how a person feels.
Yeah.
They will show up most often with their hair done, with makeup on, because they just feel better. They
Yeah.
feel great about themselves. They're out, they're doing things, they're back to work, and they're So it's often that they do show up with makeup, but in general, we try to get photos that are standardized in lighting and background and makeup. And you're right. Now there's filters, AI. People are changing the appearance in so many ways on social media. So it actually does get difficult to tell
Right.
what you're looking at. So you have to be very careful about that. So you have to go to somebody you trust based on their credentials, recommendation from other patients, recommendation from other doctors. And honestly, there's so much content out there these days that it can get a little confusing. But also, go through the content of the person you're going to see, because that'll give you a deep sense of their philosophy, how they approach care, how they think about surgery, and what they value as a person in their interactions with patients, and how they will treat you. And so,
Unique. So, like I've authored a book called Your Doctor is Not God, and a lot of plastic surgeons can come with the God syndrome. Like, I know what you need to look like, and I'm going to do my best, and you're going to love what you do. But
you know,
it's
it has to
very
be a part.
individual, right?
Absolutely. I think that kind of almost like patronizing relationship to care in any area of medicine and any area of really any relationship is terrible. So I always say, I say that to patients too. There's a surgeon for every patient, and there's a patient for every surgeon, and that's fine.
Yeah.
It has to be. I'm also very selective about the patients
Oh,
that
we are
I
at
do choose.
Sydenham too. It has to be a good fit because our
Yes,
members, like,
yes,
we now have like 100% renewal rate year on year because we're a good fit and they're a good fit, and that
absolutely,
has to come. We're not for everyone.
absolutely.
And when it's that, then it's a lifelong relationship. But we're going to get into all the other little things that you do once we finish the facelift. But more importantly, you really do specialize in correcting facelifts that have gone wrong. And I'm like, oh my God, going through a facelift is traumatic. And you have to go through it again and correct it. Like, tell us a little bit about that, and then we can move to the
Yes,
lighter stuff. Like, what are other options?
yes. So finding a good match between a patient and a surgeon is the most important thing. And once you establish that, the surgeon really has to spend the time and care in understanding what that patient has gone through, especially in a revision scenario, what prior non-surgical and surgical operations they've had, where they are in that process, how they feel about all this process. It is a pretty traumatizing process when you've been through a procedure that hasn't necessarily given the results that you want, or where you're left with some sort of distortion or disability, whether that's aesthetic or functional. So, especially if that was a procedure you were doing for cosmetic purposes.
Right.
I said I'm selective with patients I work with, obviously in an elective cosmetic setting, but if it was an emergency or whatnot,
Of
you
course.
take care of the problem.
Right.
But when somebody has had a cosmetic procedure and has had complications from it, it is a very difficult journey for them. So we start with identifying the essentially the pain points for the patient. What are the things that they're struggling with? And then we need to do a deep assessment of what is the actual anatomical problem, and what procedures have been done to this point, and how we're going to address them the safest way possible and with the maximal aesthetic results. And then we devise a plan, and the plan has to be very personalized. And so my goal is always a natural result that preserves your unique facial characteristics, your unique facial features, your identity, what makes you you, what gives you your charm. And then how do we achieve that the safest way possible while preserving your anatomy as much as we can?
Some of us don't even ask these questions to ourselves, right? When we look at the mirror, we look at the mirror with different thoughts. Half the time, people are looking at what they don't like and why they're not good enough. But I love it that in your practice, you ask the question, what is your unique charm?
Absolutely, absolutely. And I think, we have so many examples right now in the media. I mean, sadly, you look at, very iconic faces, whether it's actors or others, and where, um, the things that made them so unique and that made those faces so iconic have been lost in the
Yeah.
process of rejuvenation. And a very common one is the eyelids, or sometimes the cheeks where they've been overfilled. But blepharoplasty, we tend to think about it as, oh,
Can you
it's simple.
explain what
Yes.
blepharoplasty is? And like they
So,
call it blephs.
blephs.
Okay, please explain blephs.
Yes. Let's talk about blephs.
Yeah.
So A blepharoplasty is an eyelid rejuvenation procedure.
Okay.
And what it is, so there's upper blepharoplasty, which is the upper eyelid rejuvenation, and there's lower blepharoplasty. They're very different and they need to be approached differently because anatomically, the relationships of what surround them are very different. And so in upper blepharoplasty, the usual concern that patients have when they present is they have a little bit of excess skin
Mm-hmm.
or skin laxity that has occurred with age. And, a common thing I hear is, when I put my makeup on, it's becoming more and more difficult. Or
Yeah.
sometimes there's heaviness from that skin on my eyelashes. And sometimes there's also some fullness of the fat pads here.
Yes.
Yes. So
Are those cholesterol deposits or not?
no, so there is something where there is a condition where cholesterol deposits happen. It's called xanthelasma, different situation.
Okay.
But in this, it's the natural fat compartments that we all have in the orbit here
Mm-hmm.
that with time, so there's layers of the eyelid has anatomical layers. And so there's a skin, there's a muscle behind it. And so one of those layers is a septum. It's just like a wall, like a thin wall. And there's fat compartments behind it. So with age, sometimes there's laxity and uh, outpouching of that fat. It's like pseudo herniation or essentially
Protrusion. Yeah.
bulging protrusion of that fat. And so that's why you see it here, but that commonly you see it in the lower eyelid. You see
Yeah.
bags.
Yeah.
So those eyelid bags are just natural fat that exists there
Mm.
that is just now bulged out a little bit. And so part of a blepharoplasty procedure is addressing the excess skin, and part of it is addressing trimming away some of that fat. We don't want to remove all the fat. We don't want to, you see these old blepharoplasty where people were hollowed, you see this like very empty. That's, again, procedures. The problem is when people just apply techniques across the board, you see these unnatural results. Every procedure has the potential to be overdone, misused. A big example is fillers. Filler is not a terrible thing out. I mean, there is a good way to use fillers if you use them very conservatively in small amounts in the right places.
Yeah.
But when it's overused, misused, and especially repeatedly, that's where you see terrible problems. Same thing with surgery.
So, what are the other things that we can do from a longevity perspective? Because people are aging, and somewhere that aging is artificial because of Ozempic or because of weight loss. So, how should we go about that decision making? What should we be thinking about?
Okay, so let's talk about facial aging.
Mm-hmm.
There are three main themes that are happening with aging of the face.
Mm-hmm.
One of them is a change in the texture and in the quality of the tissues. So that's where, changes in collagen and elastin, and that's where the quality of the skin is changing with time. There's also a loss of volume, and that's loss of the volume of the natural fat pads that we naturally have in our faces. And so there's fat pads, in the orbits, the temples, the cheeks. And so what is happening with age is you have change in the quality of the tissues, you have loss of volume, and you have gravity over time. So those three things are causing, the loss of volume, and then the tissues around them are sagging down
Mm-hmm.
because they don't have the same elasticity and they're just subject to this gravity. And so how we address aging has to be addressing those three components. At least there's other nuances to it, but that those three themes have to be thought of. And that's why we have so many different modalities in each of those categories. Now, with weight loss, the biggest thing obviously is the loss of volume.
Right.
But the problem is that it happens very rapidly with those medications, with GLP-1 agonists. Because that massive weight loss happens very rapidly, the skin and soft tissues don't have the chance to adapt. And you see the sagging. Also, usually the people who are seeing those changes are taking the GLP-1 medications and they are already in their 40s and 50s and 60s. There's already been a loss of collagen and elastin and so on. So
And the hormones and
the hormone, absolutely. And so there's the ability of the skin to keep up and adapt is very, very different from somebody who's in their 20s and 30s and loses some weight and is able to recoil from that. And so it's the amount and rapidity, and it's also the age and the nature and quality of the tissues at that time. And
so what are
that's
the
what
little
it's-
things that we should be doing to preserve and prevent like
Yes,
drastic aging on the face.
that's
And you do the neck too, so include the neck.
absolutely.
Feel free.
And
Give us young necks.
I'm glad you brought up the neck
Yeah.
because a facelift that ignores or undertreats the neck, you can immediately recognize there's a, we tend to think, again, it's like the mind body thing. We tend to think of the face and the neck as two separate areas, but anatomically, they're really connected. They're really connected. The platysma muscle that does this goes, from the clavicles all the way up into the cheek. And so the jawline, the jowling that you see, you tend to think of it as, okay, well, can I get a neck lift and improve this area to my jawline? Yes, but if you have facial aging and neck aging and you just treat the neck, this mismatch is gonna
Yeah.
you're gonna feel a disharmony. And the same goes when you treat the face and don't treat the neck. So they have to really come in together.
Yeah.
And then so what can we do? What can we do about it? So the recommendations are gonna be there's always gonna be skincare and improving your skin health and addressing texture changes and skin quality. And then we want to work on the volume that we talked about. And then if the tissues have sagged enough, then we want to talk about things like a facelift or a neck lift. So
Would Botox and fillers come
yes.
before, like
So
in that decision making
yes.
journey, or?
So both are, I think, great tools when used appropriately. So Botox is relaxing the muscles. It's just a relaxant of the muscles. And so the muscles that create facial expressions, naturally, because they're moving all the time, creating facial expressions, the skin above them is going to form creases.
Yeah.
And so that's why we see horizontal lines here, because we have a muscle that's going to lift the eyebrows like this, the frontalis. We see vertical lines here because we have a muscle
Yeah.
that's contracting in a different vector. And then, so we have the procerus, we have the corrugators. And so you start seeing these different lines for those reasons. You have a muscle here that's circular, so you see the crow's feet. And so Botox will relax the muscle, and by relaxing the muscle, will smoothen those lines on the skin. And that's the role of Botox, is we're going to try to remove those fine lines that have happened.
So somebody who's lost weight on Ozempic and never done Botox before, should that be a first option to try, or it won't help at all?
In the setting of an Ozempic phase, the Botox is only going to be helpful, for the most part, in the upper face and the fine lines around the forehead, between the eyebrows here, but it's not really treating what happened with weight loss.
So on the lower half, like,
And the lower half, sometimes, yes, the DAOs here, you can treat some of that drooping here.
yes.
You can work a little bit on the platysma muscle, but it really depends on how advanced those changes are. And people who have really lost a lot of weight, that's really not a modality that's going to offer much. What offers the most results in a real situation of weight loss or Ozempic phase is a combination of fat grafting, so using your own fat cells that are taken from the belly or from the thigh and putting them exactly where the volume has been lost. So
Just like a natural filler?
yes, a much better option than fillers, because it's your own live cells that are going to not only restore volume, but they're actually going to be there permanently. They're going to live there, and they're natural. They're your own cells, and they're going to bring with them a lot of growth factors and a lot of good factors that are going to improve the skin quality and skin texture. So fat grafting is really the best thing you can do. Plus, and obviously you want to do it tastefully and in a targeted way.
Yeah.
We're not just going to overfill the face.
No.
We want to fill the things that have been lost. Plus, face and neck lift to reposition things where they used to be, where they need to be.
So that brings me to our next section, which
Yes.
is our rapid fire round.
All right. Let's do
And
it.
we do a hot or not questionnaire. And the first question is, if you feel that facelifts before 40, are they hot or not?
Facelifts before 40. So I would say not hot. I would say they've been made hot in social media. But I think if you're younger than 40,
What if you were obese and you've gone on Ozempic and you've lost 100 pounds?
in that situation, yes. But it's important to know that that's a very select group of people, and not everybody who's under 40 should be running to get a facelift. But yes, if you've lost a lot of weight, or if you have a certain anatomy, genetically, yes, this can be a great solution for you. but it has to come from a proper assessment and physical exam, and rather than a trend that everybody jumps on because they think if you get it early you're going to age better.
Well, tell us about that. We didn't
Yes.
get into that. Like, if you get one facelift, how often can you get the second and the third in your lifetime? Like, and you do corrective ones, of course. Like, does that impact it? So, do we have a finite chances at this? And how do we go about that decision making?
See, that's a great question. But that's exactly why if you get so a facelift has a lifetime, right? At around 10 years, 10 to 12 years, 7 to 12 years, around those times. It's different for everybody. And again, if they're continuing to lose weight or anything else, that can get affected. But let's say around 10 years. If your facelift is going to last around 10 years and you get your first facelift in your 30s, well, what are you going to get like 4 or 5 facelifts throughout your lifetime?
Can you?
Some people do. So it's not everything that's technically feasible should be done, So that's where, yeah. So
Ideally, do you think we should plan for 2 facelifts in our lifetime with this modern longevity approach?
well, it depends on your aesthetic goals and it depends on your health.
If we want, like, our members all go for peak performance. They want to feel their best, they want to look their best. So should our Sydenham members be like aspiring or budgeting time and money for 2 facelifts in their whole longevity plan?
I would say if you're somebody who's really wanting to maintain that kind of a aesthetic edge, that is reasonable. But again, some people don't get a facelift and are very happy. Some people get one facelift and are very happy with the change, even though the process of aging is going to continue.
Right.
So the result is going to change over time because aging of the tissues is going to continue, gravity is going to continue, and so on. But you can maintain a lot of that benefit from the result just by having gotten the face. Actually, you do maintain some benefit, and also with proper maintenance and non-surgical therapies, you can maintain a lot of it. So a lot of people might be happy with just one, but it is not uncommon over the course of 1, 2, 3 decades to get a second or a third, and those additional surgeries don't always have to be redoing the whole thing as a revision facelift. A secondary facelift can be more limited depending on the patient's health, their
Also, in
aesthetic
15
goals.
years from now, there'll be newer technologies, so we shouldn't be that
Also-
scared to take the plunge.
Also, I think it's about being informed and doing things that align with your goals and that are not going to put your health at risk, and doing it in a measured and a controlled way.
Sorry, our rapid fire round is not as rapid because I get like distracted
but-
with all the lovely
I
information.
love it.
So, upper blephs, are they hot or not?
Okay, upper blephs are hot. They're very hot.
Face yoga, is it hot or not?
Face yoga, I'm going to say not.
Thread lifts, hot or not?
Not, absolutely not. Do not get a thread lift. I think there are way better options if you're going to go the route of doing something that introduces scarring in your face. And threads are a blind procedure where people are going to just go in with a thread and try to lift or tighten things up. They're also, the result that you get from it is, counts as temporary, even when they're successful. So I think you should really before you start getting thread lifts, you should get a good consultation with a plastic surgeon and then really, really think about your options.
Sculptra, is it hot or not?
In my book, Sculptra has very, very limited meaningful use. In my book, I would say not hot. So Sculptra is a biostimulator. It's the hype around it is that it's going to create collagen.
Mm-hmm.
Think of that created collagen also as a form of scar. That's what scar is really. So if your body is creating,
Right.
the way it's creating collagen is it's creating collagen as a reaction to these little granules that were placed. And so that foreign body reaction, really, it's a reaction of laying down collagen in locations where we don't naturally have layers of collagen. They're trying to replenish that lost fat volume with collagen. That's not the natural way to do that. If you can replenish the lost fat with fat, that's as natural as it gets.
But does that interfere in a future facelift?
It can, and it doesn't mean that a future face is going to be impossible. I've done facelifts on patients who've had Sculptra, who've had threads, who've had fillers, and so on. but it's important to know that those modalities can introduce scarring, and sometimes that scarring is pretty significant. So the plastic surgeon, first of all, has to modify sometimes the procedure or approach the procedure. It makes it a little bit more complex, and how the dissection is done. The risk of that procedure can be a little bit higher, but the key is approaching that with the proper analysis and care and technique. It's not impossible, but it's definitely, it makes it a little bit closer to a revision facelift. So it has to be approached with a lot of care.
So, before we wrap up, we would like to ask you one question around your own longevity hacks and your own personal health and wellness routines. Can you share with us some tips and tricks that work for you? We know one size doesn't fit all, it's very individual,
Yeah,
but just to get to know you a little better.
everybody's different. I'm
Yeah.
going to say, forget about all the hacks. I'm going to say the number one thing is, you know, don't forget that we are social. I'm not gonna say animals, but we are social beings,
Yeah.
and so you do not. I mean, I know that everything is becoming so individualistic, but we do not live in a vacuum.
No.
And so the number one hack is stay close to the people that make you come alive. Stay close to your family, to your friends. Check in with them. Check in with your community, the people around you, and I get so much satisfaction and the fulfillment from
Mhm.
every interaction with my patients, because we have so many opportunities to see things from a different perspective, to understand each other, to make a positive change in each other's lives. But if you think of it, at any moment of the day,
Yeah.
if you view all interactions like that, it's such an, I think that is, I think, the biggest hack that I'll give. And then on top of that, obviously, you can't be at your best. You can't give people your best if you're feeling drained and empty.
True.
So take care of your number one, take care of your sleep,
Mhm.
your diet, what you put in your body, exercise, ideally daily, and then I'm a morning person.
Mhm.
So I think no matter where you do that during the day, but have some time that is entirely yours, like
Right.
an hour, 2 hours, whatever it is, because we're always on our screens.
Right.
So I think time where you actually get to think,
Mhm.
and you
Gratitude.
actually get, yeah, yeah, I love that. Yeah, practicing gratitude.
Mm.
I do it all the time. I'm always very grateful because
Well,
it is pretty special that we
yeah.
get to do what we do. And I mean, just having this conversation, very
I
grateful
know,
for that.
no, and it's that's what makes it so beautiful for us, especially being in Beverly Hills. Like, there are physicians all around us, right? And for Sydenham, this is unique to find like-minded, people. When you walk in, you saw that gorgeous longevity lounge, right?
Amazing. It's
And
beautiful.
if you're like, why is this a doctor's office? We're like a social club. We're like, yes, we are a social club because the secret to
That's
longevity is
incredible. I love
community.
that. I
You
love
don't
that.
see hyperbaric chambers here. You don't see red light therapy here. No, our members have that in their home. That doesn't build connection. Our physicians are giving talks here. We have all the other physicians in the community, who come and train other physicians, and they educate each other. And that
That's
fosters,
amazing.
collaboration and
I love that.
connection.
I love that. No, you've definitely created kind of a beautiful synergy
Yeah.
of a lot of different specialists and a lot of different players in this field, and I think that's a very, very special
Yeah.
special thing that you're offering patients.
And the physician patient relationship, it's so sad, but the traditional system limits it to that 7-minute medicine model. You're fortunate that you're in a space which is mostly user pay, right? So you have that luxury to spend a whole hour with a patient.
Absolutely. Actually, my consultations are an hour long.
Yeah.
And then I, on purpose, I deliberately created, my aesthetic practice for that reason, because I felt, my father is a primary care physician,
Yes, you
and
do. You're both your parents
my
are from
mom,
the
yeah,
world of
my mom
medicine.
is a
So
pharmacist.
tell us a little
Yeah.
bit about your
Yes.
background. Like, we
Yes.
want to get to know you a little better before we wrap this
Of
up.
course, of course. So my dad is a primary care physician and my mom's a pharmacist. So I grew up surrounded by medicine, but also surrounded by those lifelong relationships that, of doctors and their patients for generations, within the same family. And that was so special to me. And that affected everything I do and how I view medicine. And so our apartment was facing the clinic. And so it was,
And where was this? Where
and it
you
was
grew up?
old school. So it was all the way in Beirut, Lebanon, actually. And so my dad would, it was very common for somebody to come in and knock at the door at 2 a.m., with a sick family member. And my dad would just, put on a rope, put on a stethoscope, open the clinic, go in, examine
Trust
them,
me, I
and
come
treat
from
them.
India and medicine is like that.
Right?
Yeah.
And that was
But
like
those
old
physicians
school
have
medicine.
no work, like you still have work-life balance.
24/7. Yeah, he was 24/7.
Their whole life is of service.
But you know what? My patients have my personal number.
Yeah.
I want to offer, I designed my practice so that my patients can reach me anytime. My patients know that I have their back at any point in the process. I do not delegate. Ask me, like, oh, this person is going to come in and remove your stitch. No, I will be there. I will remove every stitch. I will place every stitch. I will be there with you all the way from beginning to end. And you can reach me at any point. And so I learned that from my father. And I mean, my dad's still like, he'll be walking in, even here in LA, he'll walk in and run into someone. He's like, "You're my doctor."
That's
People
nice.
feel, yeah, it's amazing. It's beautiful. And then, so that informed how I really view this. And so I decided, after my training,
How was Harvard? Now everybody's a
Harvard,
little curious.
of course, Harvard is obviously, one of the most unique places in the world. And
You really think it is
and
that special
absolutely, the
for medicine?
Oh, absolutely. The plastic surgery that I learned at Harvard is, you know, world class. I think the special thing about it is, the talent of the people that are there, and the fact that it has a global view on care, and the fact that it has not only, providing the most advanced clinical treatments, but also creating those treatments.
Yeah.
So a lot of the biggest innovations in our field have come from that place, and so that's why it was such a special experience to be learning not only the foundational principle but also the most advanced things. And then we had something very special too, where I, over the course of 3 years, I took time visiting the top plastic surgeons, and specifically the ones who specialize in facelift and rhinoplasty all over the United States, and spending time with them in there. And I'm very grateful for those people who have opened their doors for me to learn these more advanced techniques in a private cosmetic setting as well. And so I think I had the very unique chance to season my surgical experience, and really be able to offer patients something that is very, very fine tuned and personalized, rather than just cookie cutter approach to facial rejuvenation.
Well, thank you so much for today.
Thank
I
you.
know you're
Thank
going
you
to
so
have you
much.
back because like medical science is advancing so fast and we want to know what else is happening. And welcome to Beverly Hills.
Thank you so much. Thank you so much.
And thank you so much for being on
Thank you
Ask
so much.
Sid.
It's wonderful to be here. Thank you so much.